Hi, my name is Deborah Makanjuola. I'm a graduate from College of Medicine and Surgery in Nigeria. I went to University of Ilorin. It's located in the north central part of Nigeria. And I'm married with a 2-year-old boy, and I'm also expecting a baby.
And are you in a program at UAB right now?
Yes, so currently I'm studying a master's in public health with a concentration in maternal and child health at the University of Alabama, Birmingham. And I'm in my final semester currently.
Okay. So tell us a little bit about your background.
Okay, so as I said earlier, I graduated from College of Medicine in Nigeria. So I have a medical degree from Nigeria, and I really enjoy medical practice because I've always had passion for caring for people, caring for others, and that was why I went for medicine. Well, after my medical degree, I decided to go into public health because during my medical program, I developed interest in community medicine, especially in my community medicine posting. So I had to go for a master's in public health, and it's been so fulfilling, you know, caring for the people, not just your patients, but the community as a whole, for the general population. And I currently just finished my internship program at Health Hub Worldwide, as Health Under Resourced Biomedical Worldwide. It's been a great experience for me interning there. I've learned a lot of things. Part of the product I worked on at HUB was I developed the needs assessments, which seeks to assess the healthcare needs of the Black Belt communities. And the Black Belt community is an area located in Alabama, the southern part of Alabama and northern part of Mississippi. These areas have been known to be faced with poverty, reduced health outcomes, and I created a needs assessment to assess their healthcare needs. And I also developed the program intervention plan in assessing the needs. Ms. Laura was really helpful in guiding me through the process. She also showed me and taught me how to write a CXS grant application to assist us with the budget of the program we developed for the Black Belt communities.
So did you grow up in Nigeria?
Yes, I grew up in Nigeria.
Tell us a little bit about growing up in Nigeria and where you grew up and childhood and stuff like that.
Okay, so I was born in Kwara State. It's a state located in the north central part of Nigeria. Growing up, I also grew up in Kwara State. I had all my educational degree in Kwara State. Growing up was, well, I'll say a bit not so much fun for me because I grew up in an environment where there were not so much kids to play with, so I was always reading. I was the reading type. So I grew up loving books, reading. I don't really like to socialize as much. But when I got to the university, I had to loosen up a bit. I met a lot of people from different backgrounds, and that's helped my social life. During med school, I joined some association in school. I joined some non-governmental organization in school, went for community outreaches, and it was really fun. You know, there were times we went to the rural areas, we took blood pressure measurements, gave health talks, seminars, so it was really fun. And also, I was very active in my church. I love to sing, and I also love to act. So those are other things I did aside reading. And lastly, I also love to work with my hands. So I love baking. I know how to make hair. I just love doing things with my hand, drawing, painting. So those are the other things I did apart from reading.
Awesome, awesome. So you were actually doing some public health stuff in Nigeria.
Yes.
During med school. So tell us a little bit about how you got from Nigeria here and how long you've been here and stuff like that.
Okay, so I graduated from med school 2017. I finished my exam 2017, and graduation was in January 2018. So after then, I started my internship at University of Ilorin Teaching Hospital. But along the line, I got married, so I moved to Abuja and I continued my internship there. After my internship, I also went for a 1-year service, and there I served at a non-government organization called Center for Family Health Initiative. They cater majorly for women, children who are abused, and those living with HIV and AIDS. So it was a great experience working there as well. So after my NYSC program, I decided to apply for a master's in public health here at Birmingham, and I came into the United States January 2021.
Oh, okay, great. What have you learned the most about serving as an intern for Hub this summer?
Well, serving as an intern for Hub has been a wonderful experience for me. Before I go into serving as an intern for Hub, I started my internship at another organization initially. They were working on a study for LGBTQ, but the study was stopped abruptly midway, so I had to look for another organization, and I spoke with my internship coordinator. So she was one that suggested, and recommended me to Hub, to the director of Hub. And when I started, it was really fun because I was able to work with people who had the background that I have, as a medical background, you know, checking out medical equipment. I was familiar with those equipment, being a medical doctor, and it was really interesting and easy for me to get along. So I first started working on the inventory records. It was really fun for me, seriously, because even my director thought it was a bit stressful, but she did not know I was really catching fun. You know, it brought back the memories of med school, seeing those equipments, categorizing them, just brought back the hospital experience for me. And also working on my project, Miss Laura guided me, and she gave me the opportunity to use my initiative to develop those products. So that was really helpful for me. It was a bit brain taxing, but it really developed me and helped me. So I learned a lot about Hub. I can't really say this is the best, but this is the best thing I did. There were so many bests. So I learned a lot working with Hub. It was a wonderful, in fact, it's one of the best experiences I've had since I started working. And I will not trade it for anything.
Well, thank you. You know, y'all did a lot of work, a lot of great work when you initially started here with the inventory, because that was something that we really needed to finish up. And I'm glad you had the opportunity to work with several other folks, you know, with similar backgrounds, you know, and I know y'all had a good time. And then you transitioned into the needs assessment for the black belt, as far as just an overall view of what's going on in the black belt. You know, what health needs do they have, what's down there as far as clinics and hospitals, and then, you know, what part of Hub, you know, how can Hub help, you know, help them. So you did a great job on that, and I really felt like you developed it, and really, you know, your final product was a really good one. And then even the grant request that you and I both worked on, that was a lot of fun. That's one of the things I do quite a bit, is asking foundations for money. So I'm hoping that we'll have a positive outcome from that. We won't know for several months. They usually take, you know, anywhere from 3 to 6 months to make a decision. But I think you learned a lot on that too.
Yes.
And you know, how to format things and put it into words so that they understand exactly what we're doing. So because we are kind of unique. We're the only nonprofit that has our mission here in the state of Alabama. So I take that responsibility very seriously, because there are a lot of people that need our stuff, you know, need our help. So what are your future plans, Deborah? I know that you graduate this month.
Yeah.
And you know, and I know that we chatted a little bit about some things, but tell us a little bit about, you know, maybe some future plans coming up, and then maybe long term. They may be the same, I don't know. So
Okay. Yeah, I will graduate this semester, and well, my major plan is to get a job. in the public health profession because I love community work, community development, and interning with Hub has really exposed me to how it feels like in a practical sense. And I think I now have more confidence on working on that. So I would definitely love to get a job in that aspect, maybe pick up a job with an NGO like Hub and work with them, developing community program, conducting needs assessments, developing program policies, and writing budgets. That would be a great one for me. Then for a long-term plan, I also plan to write my residency exams in future. Currently, I'm not thinking of doing that because I have a son, I'm expecting a baby, and I want to have enough time to take care of those kids.
Yeah.
So, but in long term, when they are well taken care of, I plan to write my residency exams and start residency in future.
Yeah. So, just for the folks that might be listening to the interview, I'm familiar kind of with the process if you go to med school overseas and then what the process is here. But just for the benefit of everybody that's listening to the interview, tell us a little bit about, you know, when you go to med school, like when you went to med school in Nigeria, and then what steps do you have to take now that you're here in the States if you want to go to med school here or go to residency here, excuse me, in the States? Okay,
so the steps to take include writing the STEPS exam. We have about 3 steps. The USMLE STEP exam. So the first step is more of written exams. Then we have the step 2, which tests the clinical knowledge and the clinical skills. So it's both written and clinical practice. While the third step can be taken during or before the residency program starts. So that's the third step. I think it's more of clinical practice as well. So anyone with a medical degree, licensed medical degree, can take those exams. Okay. So either you do your medical study, medical school here in the United States or abroad, you just have to take those exams and pass them for you to qualify for residency.
Yeah. So did you, once you graduated from high school, you went immediately into med school, is that correct?
Yes.
And that's pretty common from what I understand. Outside of the United States. You know, I think we're the only one that makes you get a degree and then spend, 4 more years going to med school. So it's kind of interesting, you know, and I guess that's why they make you jump through a few more hoops, but, anyway. So what would you tell others that may be interested in an internship at Hub? You know, what do you think they can expect, or whatever you want to, what encouragement can you give to others that may be thinking about it?
Okay, so for anyone in public health, I'll really advise you to intern with Hub because it's the real practice of what we're being taught in class. I mean, you can get to put into practice. It's different. The research you do at Hub is different from like clinical or lab research. You get into the public health research properly. Getting to assess the communities, community partners, getting hands-on experience, and impacting lives, impacting the population. So it's really practical for me, and it aligns totally with public health research. So I will advise everyone in public health to definitely intern with Hub.
Awesome. Anything else you want to add?
Well, I just want to say thank you again. I really enjoyed my internship experience. I loved it. At first, I was so sad. My husband just encouraged me, no, just keep on, try. You're going to get another internship program. And I'm so grateful I got this one. It was a wonderful experience and a life-changing one. Thank you.
Thank you. We were fortunate to have you, come on board as an intern. I know that it might have been kind of stressful initially because you had started one place and then they shut their project down and we were all scrambling, but it worked out, and it benefited us, and from what I can tell, it benefited you. So we were very, very happy and fortunate to have you.
Thank you.
Summer, so thank you so much.
Thank you so much.